I worked the front desk at a hospital in Oslo, Norway. An American woman walked in last month holding her daughter's hand, the kid's arm bent at a wrong angle. She approached my desk and asked how much an X-ray and cast would cost before they'd see anyone. I told her we'd treat her daughter first and discuss payment later, but she refused to let me take them back. She wanted the exact price breakdown, demanded to speak with our billing department, asked if we accepted her Ohio insurance card. I explained 3 times that her daughter just needed to be seen by a doctor, that we'd figure everything out afterward. But she kept insisting she needed a payment plan arranged before any treatment. She actually pulled out her phone to call her bank, while her daughter sat there crying with a broken arm. The nurses finally convinced her to come back by promising we wouldn't charge her credit card without written authorization. The doctor set the bone, applied the cast, prescribed some pain medication. 2 hours later, I handed her the bill. 890 kroner. That's about $85. She stared at the paper for a solid minute, then asked where the rest of it was. I assured her that was the complete bill. She wanted to know about the doctor's fee, the radiology fee, the facility fee, the medication fee. I repeated that everything was included in that one number. She started crying harder than her daughter had been. Same week. 2 college students from Michigan came in because one had stepped on glass at the beach. Deep cut, needed stitches. Before I could even finish explaining our process, the injured one asked if they could just get super glue from a pharmacy instead. His friend said they had about $200 between them and needed to make it last another week in Europe. I told them the treatment would cost less than dinner for 2. They didn't believe me. They made me write down the estimated costs 3 separate times, each time convinced I was leaving something out. After the stitches and tetanus shot, the bill came to 670 kroner. The friend looked at his phone converter app, did the math twice, then asked if Norwegian money was worth less than Monopoly money. When I said no, he just walked out shaking his head. My cousin runs a medical clinic in Ontario. An American guy showed up needing antibiotics for what turned out to be strep throat. He'd been suffering for 5 days, apparently trying to tough it out. He asked her how much the visit and prescription would cost. She said the visit would be covered by provincial insurance, since he was a temporary resident through his work visa, and the antibiotics would run about $15. He laughed at her, told her to stop playing games and give him the real price. She walked him through it twice. He sat there in the exam room, insisting she was pulling his leg. There had to be facility charges, diagnostic fees, doctor consultation fees. She prescribed amoxicillin and sent him to the pharmacy. He came back an hour later to complain that the pharmacist was also lying to him about prices. Some people just can't accept that medicine doesn't cost a mortgage payment. My brother manages a community health clinic in Melbourne, Australia. An American backpacker came in with an infected spider bite from hiking. The bite had gotten pretty nasty, red streaks running up her leg. Before my brother could examine it, she asked if they had payment plans that accepted American credit cards. He told her to sit down and let him look at it first. She refused, said she'd seen plenty of medical bills from home and knew infections were expensive. He explained Australia's Medicare system covers emergency treatment even for visitors in some cases. Plus, she'd only pay for medications. She accused him of running a scam. Said back home a visit for an infection would run $5,000 easy. There was no way Australia just gave away medical care. She literally tried to leave with the infection, spreading up her leg because she was convinced he was lying about costs to trap her in debt. He finally got her to stay by showing her the government fee schedule printed on the wall. She took a photo of it with her phone, did some frantic Googling to verify it was real. The wound cleaning, antibiotics prescription, and follow-up appointment instructions cost her $70 total. She asked 3 times if they'd bill her hotel later for the real amount. My brother said she kept muttering, "This makes no sense," while paying. She insisted on getting an itemized receipt showing every cotton ball and alcohol wipe used, convinced hidden charges would appear later. Before leaving, she asked if Australia was accepting immigration applications because she couldn't afford to get sick in Ohio anymore. I'm an intake coordinator at a walk-in clinic in Dublin, Ireland. An American student studying abroad came in with a nasty cough that had lasted 2 weeks. She brought her passport, her college ID, 3 different insurance cards, and a folder full of medical records. She'd prepared like she was applying for a mortgage. I asked for her public services card since she was a temporary resident. She didn't have one, so I explained she'd just pay the standard out-of-pocket visit fee. She asked how much. I said 60 euros. She pulled out her calculator and converted it to dollars, then looked relieved. Asked if that was just for registration or the actual visit. I said that covered the doctor seeing her basic examination, any prescriptions needed. She argued with me, insisted that couldn't possibly include the doctor's time that physicians in the US billed separately and cost way more. I had the doctor explain it to her directly. She got diagnosed with bronchitis, received prescriptions for antibiotics, and an inhaler. Paid her 60 euros and left confused. She came back the next day to ask if we'd forgotten to bill her insurance company. We hadn't. That was the actual price. She stood there trying to find the catch for 10 minutes. My sister is a receptionist at a pharmacy in Copenhagen, Denmark. An American couple came in with prescriptions for blood pressure medication. Standard stuff. They'd gotten the prescriptions from a local doctor while visiting their son who'd moved here for work. They asked how much it would cost before handing over the papers. She scanned the prescriptions and told them 180 kroner for both medications, a month's supply each. The husband laughed and said, "No, really, how much?" She repeated the price. He started explaining to her that these medications cost him $340 a month back in Florida, even with insurance. My sister just nodded and processed the transaction. The wife accused her of giving them veterinary medications or expired stock. She pulled out her phone and showed my sister screenshots of her pharmacy bills from CVS, like she was presenting evidence in court. My sister pointed out that Denmark negotiates drug prices nationally and doesn't let pharmaceutical companies charge whatever they want. The woman said that sounded like communism. She paid the 180 kroner, but demanded extra receipts and photos of the medication bottles, convinced she'd been scammed with counterfeit drugs. Her husband spent 15 minutes at the counter ranting about how America was getting robbed. I worked dispatch for an ambulance service in Stockholm, Sweden. We got a call from an American tourist who'd collapsed at a museum. When our EMTs arrived, the guy was conscious but refusing to get in the ambulance. He kept asking how much the ambulance ride would cost. Our paramedics told him to worry about that later. They needed to get him to a hospital. He said he'd take a taxi instead. They explained he might be having a cardiac episode and needed immediate care. He asked again about the cost. They told him around 300 kroner for the ambulance. He asked what that was in real money. They said about $30. He told them to stop joking around, that he knew ambulances in the US cost thousands. He literally tried to call an Uber while potentially having a heart attack because he was convinced our EMTs were lying about the price to trap him in medical debt. They eventually convinced him by showing him the printed rate card they're required to carry. He got in the ambulance, but spent the entire ride asking questions about hidden fees and whether they'd bill his insurance or charge his credit card while he was unconscious. At the hospital, they ran tests, kept him for observation for 6 hours, determined he'd had a panic attack brought on by dehydration. Total bill was 400 kroner, about $40. He demanded an itemized invoice showing every test, every minute of the ambulance ride, every hospital room charge. The billing clerk printed it out. He stared at it, then asked where the real bill was. The clerk assured him that was it. He said American hospitals charged more just to hand you a tissue box, and there was no way Sweden was giving away medical care for $40. He filed a complaint with our manager, claiming we were running a Batanswitch operation. My cousin is an emergency room nurse in Vancouver, Canada. An American hiker came in with a broken ankle from a fall. Before anyone could touch him, he wanted a cost estimate. My cousin explained that emergency care was covered under provincial insurance. But as a visitor, he'd pay around $600 for the ER visit, x-rays, and cast. He relaxed slightly. Then he asked about the orthopedic surgeon's fee. She said that was included. He asked about the radiology fee. She said that was included. He asked about the anesthesia for setting the bone. She said included. He kept listing charges that would apply in the US, and she kept saying they were included in that one number. He refused to believe her. Said he'd broken his ankle in Texas 2 years ago and the bill had been $18,000 after insurance. She showed him the provincial fee schedule. He studied it like it was written in code, convinced he was missing something. They set his ankle, gave him crutches, and pain medication. The bill came to $640. He paid it but wouldn't leave. He sat in the waiting room for an hour expecting additional bills to come. My cousin finally had to tell him they were closing the department for the night and he needed to go. He asked when they'd mail him the balance. She promised that was the complete charge. He looked at his credit card receipt and said, American healthcare was a scam. She agreed. Then he asked if he could just live in Canada instead. She told him immigration was complicated. He limped out on his crutches, muttering about moving to Toronto. I'm a phlebotomist at a medical lab in Wellington, New Zealand. An American woman came in for routine blood work her doctor had ordered. Standard metabolic panel, nothing unusual. She asked how much it would cost before I drew any blood. I told her since she was a temporary work visa holder, the blood draw was covered, but the lab processing would run about $30. She stared at me, asked me to repeat that. I did. She said the same blood work cost her $280 back in Michigan, even with insurance, and that was just the lab fees. The actual blood draw charged separately. I explained that we don't operate that way here, that healthcare is a public service, not a profit center. She accused me of scamming her. Said she wasn't going to let me draw her blood until I gave her a written quote with all fees listed separately. I printed out the lab's official price list. She examined it with suspicion. Asked why the prices were so low compared to America. I told her, our government regulates healthcare costs and negotiates with providers. She said that was socialism. I shrugged and prepared to draw her blood. She made me show her that I was using new needles, new tubes, proper safety equipment. She took photos of everything for her records. After I sent her samples to the lab, she sat in the waiting room for 20 minutes, convinced someone would come out with additional fees. When no one did, she came back to my station and asked if I was sure they wouldn't mail her a bill. I assured her the $30 charge was complete. She left saying she was never going back to America. The next week, she brought her husband in for blood work and spent the whole time explaining to him how the medical system here was actually functional. My brother drives a medical transport van in Brisbane, Australia. He picked up an American couple from the airport who needed to get to a hospital for the husband's dialysis appointment. They'd arranged everything in advance through the hospital's international patient program. During the drive, the wife asked how much the dialysis session would cost. My brother said he didn't handle billing, but knew it was significantly less than us prices. She said her husband's sessions cost $3,200 each back home, 3 times a week. He told her Australian public hospitals charged a fraction of that. She said there was no way that kidney dialysis was expensive everywhere because of the specialized equipment. He suggested she ask the billing office when they arrived. She spent the rest of the drive Googling Australian dialysis costs on her phone, convinced she'd find proof it was just as expensive at the hospital. The billing coordinator told them the session would cost $800. The wife broke down crying. Said they'd been budgeting $3,200 and had been terrified. They'd have to cut their vacation short for medical bills. The coordinator explained that Australia's healthcare system aimed to keep costs reasonable even for international patients. The husband asked if this was some kind of charity program. The coordinator said no, that was the standard rate. The wife couldn't process it. She kept saying she'd spent 20 years watching her husband's medical bills drain their savings, forcing him to choose between dialysis and their retirement fund. My brother drove them back to their hotel after the session. The wife asked him why Americans put up with their healthcare system when the rest of the world had figured out how to make it affordable. He said he'd been wondering the same thing for years. I'm a tour guide in Edinburgh, Scotland. Last summer, an American guest on my walking tour twisted her knee on the cobblestones. Not badly, but enough that she couldn't keep walking. I called for medical help. She panicked and begged me to cancel it, said she couldn't afford an ambulance. I told her not to worry about the cost. She started crying, said even with insurance, her last ER visit had cost her $4,000 for a sprained ankle. I assured her the Scottish NHS would take care of her. She accused me of not understanding American medical debt. I helped her sit down and waited for the ambulance with her. When the EMTs arrived, she asked them to just tape her knee and let her go. They insisted on taking her to hospital for proper evaluation. She refused until I promised to help her navigate the billing process. In the ambulance, she kept asking the paramedics how much this was costing her. They told her to stop worrying about money and focus on her knee. At the hospital, x-rayed her knee, confirmed it was a sprain, gave her a brace and crutches, prescribed anti-inflammatories. She asked for the bill. The nurse looked confused. Explained she wasn't a Scottish resident, so there would be some charges, but they'd send the bill to her hotel. The woman demanded the amount immediately. The nurse checked with the billing department. They estimated around £150 for the whole visit. The woman asked what that translated to in dollars. About $190. She sat there stunned. Said the ambulance alone should have cost thousands. The nurse told her this was normal, that healthcare wasn't meant to bankrupt people. The woman left on her crutches, texted me later saying she'd joined a Facebook group advocating for American healthcare reform. She'd apparently become an activist in the span of one sprained knee. I work at a medical records office in Rotterdam, Netherlands. An American graduate student came in requesting copies of his medical files from a clinic visit 6 months earlier. He needed them for his insurance company back home, which was questioning some claims. He was prepared to pay whatever it cost. I pulled his file and made copies. He asked about the fee. I said there wasn't one for the first copy of your records. It's part of the patient's right to their own medical information. He insisted I was missing something. Argued that in the US, medical records cost $50 to 100 hours copies. I explained that Dutch law guarantees patients free access to their information. He asked if he needed to submit a formal request or fill out authorization forms. I told him he'd already done that by asking for them. He demanded a supervisor confirm this was legal, that he wasn't getting me in trouble by taking documents without paying. My supervisor came out and verified everything I'd told him. The student just stood there holding his file. He said he'd once paid $85 for 3 pages of medical records in Boston. My supervisor said that sounded criminal. The student laughed bitterly and said that was just normal American healthcare. He asked if it was too late to give up his US citizenship and stay in the Netherlands permanently. My supervisor said the immigration office was 2 blocks away. The student actually walked over there after he left our office. We saw him a month later when he came back to get more records for his ongoing insurance dispute. He was still shaking his head about the whole experience. Said he'd spent more on photocopies at his university library than on getting complete medical records in the Netherlands. My sister works at a clinic in Helsinki, Finland. An American tech worker who'd relocated for a job came in for a regular checkup. Nothing wrong with him, just wanted to establish care with a local doctor before any problems arose. Smart guy, being proactive. He'd scheduled online through the public health system. At the desk, he handed over his residence permit and asked about payment. My sister told him the visit would cost €20.60 as a public health patient. He looked skeptical. Asked if that was just the registration fee. She said no, that was the complete cost for the doctor's visit. He explained that his last checkup in Seattle had cost him $250 even with insurance, plus separate charges for any labs they ran. She walked him through the Finnish system. How the government subsidizes healthcare, how it's considered a public good rather than a profit opportunity. He kept asking, clarifying questions, trying to find the catch. The doctor saw him, did a full examination, ordered standard blood work for a man his age. The patient kept asking about additional charges. The doctor assured him the lab work was included in the nominal fee he'd already paid. After the appointment, he came back to my sister's desk. He said he'd moved to Finland for the job, but after seeing how healthcare worked here, he'd stay for the system. She asked if he'd had bad experiences with American healthcare. He laughed and said bad didn't cover it. His wife had given birth to their son in the US, and even with premium insurance, they'd paid $7,000 out of pocket for a complication-free delivery. In Finland, the total cost would have been around €200. He asked my sister why. Americans defended a system that bankrupted them for having babies. She said she'd never understood it either. He scheduled his next checkup before he left. I'm a billing administrator at a hospital in Toronto. An elderly American couple came to the hospital office last week, both looking stressed. The husband had needed emergency surgery for appendicitis while they were visiting their daughter. The surgery had gone well. He'd recovered fine, and they'd been discharged 3 days ago. But they'd come back because they were convinced we'd made a mistake on the bill,